Conversations in and around menopause have moved from hushed, quiet circles amongst friends to mainstream media, and we are all the better for it. Until the last few years, many women suffered in silence as they began to experience hot flashes, night sweats, forgetfulness, and fatigue, to name but a few of the many symptoms women go through during this time. Thankfully, this topic is not taboo, and we are learning more and more about effective treatment options daily. Dr. Christine Palmay is here today as part of our ongoing series with Caretoknow.ca to address what's new in the area of menopause treatment. Welcome back, Christine.
Thank you so much, Candace.
I know for sure we don't have enough time to get to all of that we need to in 6 minutes. So let's jump right in. What are the most common complaints women come to you with about menopause? How does it impact their lifestyle and health?
So, I'm going to start off by saying it is not talked about. There is still a silence and a stigma around menopause, partially because I think females normalize this transition as something every woman has to suffer through. That is incorrect. And also, about 15 years ago, there was a pivotal trial that resulted in some scary concerns following hormone replacement therapy. We've since done the research; things have come back to a more balanced perspective. But the shadow of those studies also further made it a difficult topic because healthcare practitioners were simply number one, not educated, number two, scared, and number three, almost unwilling to prescribe these medications. In terms of women coming in, I think there is a gradually increasing war cry as women start understanding that their symptoms can be treated. And we have to understand that menopause is not just hot flashes. Menopause includes cognitive issues, brain fog, vaginal irritation, joint pain, fatigue. It's really a gamut of symptoms that drastically reduce the quality of life for a female.
So I mentioned a few of the symptoms at the beginning. I myself at one point was having 20 to 30 hot flashes a day
Hi.
before I actually really started to research this. But what are some of the other really common symptoms?
Insomnia, sleep difficulties, that's top of mind, and often a patient won't identify that as being a peri or postmenopausal issue. Vaginal irritation, dryness, bladder symptoms, the sensation that you have to urinate, irritability, joint pain, heart palpitations. Certainly the list is long, and I have learned that I have to proactively ask some of these questions because number one, they're not necessarily appreciated as being part of the menopause transition period, or they're just normalized. Every woman, my mother, my sister went through this. I have to go through it. And I want to make sure the take home message today is that we don't have to, and there are options.
Is there anything new on the topic of menopause that we should know about?
And there's once again ever evolving field, particularly now with a grassroots war cry to have solutions in place. We have newer medications available, uh, both in all types of forms: pills, patches, rings. There's a huge now push to cater medications depending on specific symptoms. So if a patient only has vaginal irritation, we can target that. If a patient has hot flashes, there are medications that specifically address that. And then we're also looking at, other ways. Cognitive behavior therapy has newly been shown to really dramatically reduce the burden of hot flashes. I'm recommending it to patients as well. And general lifestyle changes. So, exercise, maintaining a healthy body weight. Research is truly exploding. The guidelines were updated in 2021, but I expect that updates will be ongoing on a rolling basis.
I think a lot of women get to menopause, and of course, HRT is the natural thing they want to talk about. What are the risks versus the rewards when it comes to hormone replacement?
So, like everything in life, there's a benefit and a disadvantage. So, certainly with HRT, women with a risk of cardiac disease, with undiagnosed vaginal bleeding, liver issues, uh, thromboembolic history, so if you have blood clots, you are not a candidate for HRT. But the benefit of HRT to replace what the body is no longer making is treating some of those terrible symptoms that we listed. And quite frankly, at the end of the day, improving a patient's quality of life, it truly is a game changer when done properly and safely.
So I know that when I first started to experience symptoms of menopause, finding experts who were really knowledgeable in the field was difficult. I was getting a lot of misinformation, disinformation, bad advice, generally from Dr. Google, who we've talked about previously. So tell me then about what are some of the best ways to stay on top of all of this information out there that's coming to light now with all of this research into menopause.
I'm going to repeat myself. Being informed is being empowered. For our female listeners, please access information from a credible site and perhaps even present this information proactively to your primary care provider. Care to know? Access the website at Caretoknow.ca is a wonderful research. It's credible. We have experts from multiple fields. You can access information safely. And it is also, number one, free. And number two, hassle free. Once you subscribe, emails will be instantaneously delivered to your email account. The Instagram handle is care to know underscore.
All right, wonderful. Thank you so much for joining me today, and we'll see you next month.
See you next month.